Can you describe what context management is and single sign-on in the context of what the military is doing?
Absolutely. So in the context of military health has, at any given time, 20 plus clinical applications that all have unique sign-ons, a logon, usernames and passwords. They're all different, built differently, so you've got web-based applications, you've got client-server applications, you have legacy, MUMPS-based applications, terminal-based applications. And so the need for single sign-on and context management really has arisen from our providers providing care to our about 9 million beneficiaries throughout the world, Army, Navy, and Air Force beneficiaries. And patient care has been, somewhat constrained because, logging into multiple applications on a provider's desktop, you've got multiple clinical applications, and as you move from application to application, the provider would have to, again, log on multiple times, do a patient search in a new application. So as a patient is up in ALTA, which is the electronic health record for military health, and he moved to a new application, he would have to log on and then do a patient search in, for example, Essentris, which is their inpatient record. So a lot of username and passwords, a lot of search, so a lot of time is consumed moving from application to application. So the idea of military health implementing single sign-on and context management across the entire military health system, from theater operations, which is in Iraq, Afghanistan, to all the military treatment facilities in Europe and throughout the United States, was to improve patient care by enabling physicians to quickly, more accurately access the clinical systems.
How are they able to use that under battle conditions?
Well, that was one of the unique things about Carefx and the selection of Carefx as the context management solution. When we were awarded the contract was somewhat unique for military health. Rather than Vangent selecting a product and coming to the marketplace with a product, we did a 30-day analysis of alternatives. And we had to look at many different environments. So you've got, as we deployed to theater, we had to support an austere environment, which means no connectivity. So, in the battlefield, we could have a situation where there could be low comms or no comms, and we'd have to be able to sustain in that type of environment. Same thing in the U.S. at a military treatment facility, we'd have to do the same thing. And so when we looked at the systems and made the recommendation to the government, it was one of the most important things was for a system to be able to operate in an austere or low connectivity or no connectivity environment. Hence, one of the reasons we selected Carefx as the solution, or made that recommendation to the government for Carefx as the solution.